It's so great to talk to you. Introducing Mr. Karl Haviland. Karl is actually Felician's former Chief Information Officer and was such a pleasure to work with. So, Karl, you are continuing to do amazing things. You co-founded and are CTO for an artificial intelligence company, Nearly Human. Tell me, what does your company do?
Well, I appreciate that kind introduction, Daria. I help rebrand actually an AI company, Nearly Human, and we're attempting to solve this really complex problem of how do you insert virtual employees, no different than like you hire somebody, a person. What if you could hire a virtual employee into your business? And so like our AI is able to take speech, it's able to take emails, text, and these different channels that you communicate and blend them together and be able to communicate across the business, solve problems, learn, handle different tasks. It's meant to augment the people that are there so that you can build out better customer relationships. But that is the premise of our AI. We've since worked on helping other companies build out using our AI pipeline, our AI process, and also our cloud services process. So it's been something that we've explored as supplementary services, but that's the crux.
So I remember once we were talking and you're telling me about, maybe future generations won't have to learn to drive because the car's driving themselves, so to speak. And it's just mind blowing to think of that as driving as an antiquated skill set. It's hard to imagine all the changes that are forthcoming. And I read in a Institute for the Future report that this is completely mind blowing, that 85% of jobs in 2030 have not yet been invented. From your perspective, what does the future of healthcare look like, thinking about the influence of AI technology?
Oh, that's a great question. There are so many different aspects of healthcare that are currently, like, this is happening. So this isn't even like that far off into the future. Different healthcare systems have taken on AI as a tool for diagnosing problems. There's that triage process of pulling together different symptoms, different problems, and even being able to read printouts across I don't know, different checkups, different, I want to say readings of the individual, like their temperature over time, or, did things about like their blood, reading different things in their, like, that are in their blood. And so AI is really good at being able to differentiate different classes of problems and the likelihood of what should take the doctor's attention. I think it's a really powerful thing because if they're able to get high rates of positive or affirmative diagnoses using AI to classify these problems that a patient might have, what ends up happening is the doctor has spent less time like trying to figure things out, and then and more time involved in actually solving the problem. And sometimes time is very short. Like, you don't have a whole lot of time to figure things out. And the other aspect of that is it takes a broad set of learning and real world experience into account. Whereas, like, if you're working with a doctor and the doctor is working off of their own experiences, it is very limited. That doctor is learning all the time and new advances are happening elsewhere. Artificial intelligence, data science, machine learning specifically can bring out advances that are happening in real time across the nation. So especially like if you're able to tie different care centers, things like that, and tie together different outcomes, you can get a lot more bang for your buck. But that's happening right now. Although there's things that a healthcare system has to navigate, like PII, and then also understanding different demographic information about how diagnoses are come out of, like, decisions that come out of these AI and machine learning systems. They have to take those into account. So it's quite the process. And the relationships with, like, these data scientists, sometimes, like, the hospital systems, in most cases the hospital system will employ them because they have to regulate access to this information, and it's very, very sensitive. So there are things that there's just an infinite number of ways to actually apply this. And it doesn't surprise me that you said 85% of jobs in 20 haven't necessarily been invented yet for 2030. It's a funny way of looking at it, only because, at least from my perspective, there's going to be this concept of actually hiring these, I guess you could call it, nebulous virtual employees. This concept of an employee, or a concept of a job, is going to be taken on. It's going to evolve,
and new roles to maintain these applications, right?
What's that?
New roles, because these products need to be maintained.
Right. There's and this has happened over time, like, as technology has advanced. This has played out in many cases, where people think that because new technology ends up handling some of the work that has previously set out, or previously, their jobs, like, dedicated to that task, what ends up bearing out, is we can actually exponentially increase the number of jobs. It's just that they start to change. Every job has not stayed static over time, and that's because new tools come out, new technologies come out. They're tools to do maybe, like, different jobs. And so, like, in this case, being able to diagnose or read software that's able to triage across diseases and rare things that maybe you don't even know about, that's a really awesome tool set to have at your disposal. And so, like, you can see more patients, and so, like, you see more patients, and all of a sudden, like, it increases the amount of work that you have to do, and, like, you're more successful. You have less bad outcomes. So that, that's kind of how I view it.
And you just kind of touched on the next question I have, which is, the medical information is obviously sensitive, and yet these machine learning products are assisting with clinical decisions potentially. What are some of the ethical considerations?
Well, that's a great question. That's another great question, because it's still being, because the integration of AI in our society across different industries is so new, only like a couple years has it truly, like, begun to infiltrate daily life. We're starting to learn how these data science models influence outcomes in what would be considered, like, inequitable. They have bias towards different demographics because their models are based on real life outcomes. Like, we take real life things that are happening and we put them into the model, and they're meant to predict using the same approach. And a lot, as we know, our society and the way we make decisions is very flawed as humans. So we have to, like, what ends up happening is that people, data scientists, need to be involved in the process to introduce ways to combat that, so that it you know, when real life decisions and outcomes end up playing out because of these imperfect models, those are our problems. And I mean, like, key examples could be, you know, maybe there are poor neighborhoods or different demographics that end up showing up to one specific hospital, and so you only get diagnoses or outcomes based on those communities. That can have a heavy influence in the models that come out and diagnose. And so, like, a person who's not from that ends up being misdiagnosed. So, like, we're talking about healthcare and how that can affect healthcare. That's like one of the most important things in order to solve, because they have to look. I mean, no different than when you do studies. You have to make sure that you get from a broad set of communities, and you have to, like, adjust for bias statistically. And really, AI and machine learning, it's like fancy math. That's kind of like really what you should think about it as. You know, we talk about AI, you know, being able to think and learn in a way that, like, a human, and it's nothing like that. At least at the moment, we haven't discovered the math or the compute processing to, like, actually make that a reality. But that is the case. That's where people can be inserted in the process to really make sure that you're using a broad community, that you're not negatively influencing different demographics as a result, and, like, you know, end up in negative outcomes. Like, you're trying to remove those negative outcomes.
Right. So your model's only going to be as good as the data. Like, you really have to know where your data is coming from. Does it include a hospital that treats a lot of a particular population? Because if it doesn't, then that model is not covering that population.
Exactly. That relationship with the doctor and the nurses, like that, the hospital staff, or like the researchers, and then also the data scientists, that relationship is so important, because data scientists, they think in terms of math and, like, how do I create, you know, okay, thank you for your data. I'm going to spit out these models, and sure, when you run the predictions against the communities that are, like, maybe the nearest communities and different types of people, sure, they might produce positive. You're like, oh, look how great it's performing. And then all of a sudden you get somebody who doesn't fit that model. That's the danger. And then all of a sudden, you know, it's predicting wrong. It's not, like, it doesn't work. And then it has a real life outcome. You know, that person could be sick for a lot longer than they truly needed to. So it's used as a tool. And that's so that's, like, an important distinction to make. When I say AI, there's, like, actual decisions being autonomously made. And this is just the way that I kind of, like, I segment the two. Whereas, like, data science and machine learning is just a tool of prediction. Like, it's using math to predict, take all these different data sets and predict. And so, like, a doctor is interpreting that. So it may not be truly AI, you know, where it's, like, autonomously figuring and making, like, patient decisions. But what it's doing is it's giving information to the doctor, and then the doctor should look at it and say, you know, I don't know if this is right or not.
Right. That's a great point. It's really augmenting the information that they have at hand. It shouldn't be used in place of actual critical thinking and decision making by humans.
Right.
My last question is, so I recently completed a certificate program in AI and healthcare from Stanford University, and it was really getting very technical and in terms of decision curves and the whole process of machine learning and looking at clinical utility. What do our healthcare leaders really need to know about AI? And are there any particular continuing education sources that you could recommend? What should our students who are healthcare leaders, what should they really know about AI?
The first thing that I would say is not to be scared of it, because it is a scary thing to, when you don't feel like you're in control. But to really embrace it. There's going to be struggles to get through these different issues, but like we're aware of these issues. You just have to you have to see the light at the end of the tunnel, and it works. The computer's really good at taking large sets of information in a way that a person isn't, and it has saved lots of lives. We've seen that across all different types, not even just data science and AI, but with surgery, robotics and surgery and different tools to read information about the body. These are really important things. And so we need these systems to come together to save lives. So we've dedicated to helping patients in the best way possible. And technology and AI can do that. So that's the number one thing that I would tell all people, and to embrace these changes. I don't know that I would necessarily tell all of them to go out and attempt to create data science models on their own. I mean, it's an interesting thing to do. There are plenty of tutorials out there, YouTube videos. You can just Google it if they're curious. I mean, I've met several healthcare professionals who are techie, and they just want to learn a new skill and just want to kind of touch and feel, see what it's actually like, what's going on. But what I would recommend, I guess the second thing that I would recommend is be involved in the process, because that relationship between healthcare professionals and data scientists is so important. And that's really what's going to get through those problems faster.
Right. I mean, when models being built, they need to, the data science side needs to understand how is this going to be used.
Yeah.
Because if there's a disconnect there, that's a problem.
Yeah. They're not seeing patients every day. And when they're they have these test sets, so they'll test out whether or not their models are working. They need the doctors involved to give them that higher level. And so there's kind of this downloading process where I have to get inside the doctor's brain and really understand when they're looking at these different things and they're trying to figure out if it's one problem or another problem. What the model will end up doing is it'll say, I'm kind of 95% sure it's this model, so I have a high level of confidence. Or it could say, I have a little confidence over here, a little confidence over here, a little confidence over here, and I'll just give you all three. And you use this information, you choose it.
This is just amazing. And if we could build that kind of model to work within the electronic health record system, to little pop-ups or reminders, or just as a tool for the healthcare provider in making decisions, that's amazing. So I'm sure we'll see more and more of this in the future. I've learned so much, and I'm sure we could sit here and talk all day about artificial intelligence, but I've really appreciate you taking the time out to discuss this with me. And